Hello everyone, welcome to today's video. I'm Dr. Rishabh Jain. So INI-CET is just around the corner, only 15 days left for the exam. And in this video, I want to talk to you about what are the important topics for the upcoming INI exam that is to happen on 7th May. So at the outset, let me just make few points clear. INI-CET is a very previous year topics heavy exam. The previous topics which have been asked in the last 3 to 5 years, they are to be repeated. So you have to get your PYQs ready, right? Second part, it focuses a lot on first and second prof subjects. Around 60% of the paper you will find to be coming from first and second prof subjects, that is anatomy, physiology, biochemistry, pathology, pharma, microbiology, and few the final year subjects like FMT and gynae. These are very, very important as far as your INI-CET is concerned. Please don't leave these subjects. If you are short on time, you are not able to revise everything, which are the subjects you can leave. It is ENT, Ophthal, and medicine. Yes, I said it. Medicine you can leave if you don't have time, because predominantly emergencies are asked in medicine. And if you have done your internship, you can attempt to do them and you'll get the answers correct. Plus, the syllabus of medicine is very vast. If you don't have time, you can skip it, right? So let's just start with it. The important subjects for INI, I am reiterating, are first and second prof, especially pharma, biochem, micro, pathology, anatomy, physiology, forensic, gynae. These are very important subjects. Okay. Now coming to first year subjects, that is anatomy. What are the topics important in anatomy? So mainly neuroanat, cranial nerves, and in gross anatomy, head and neck. So cranial nerves is a part of head and neck anatomy and also neuroanatomy. So cranial nerves are very important topic. You cannot leave cranial nerves. You'll definitely get 1 or 2 questions coming from cranial nerves in the upcoming INI. Apart from that, histology diagrams, histology slides, very important. Embryology, you can get direct diagrams from Langman, pharyngeal arch derivatives, brachial arch derivatives, important topics. Cardiovascular system, important topic from embryology in anatomy. Now coming to physiology. So in physiology, what you'll typically get are long questions where they're asking all of the following are correct except, so there'll be a set of 4 questions and you have to, it's sort of a true and false statement, and sometimes you'll get the options like options 1, 2, 3 are correct and ye are incorrect, or it can be a match the following. So for example, 2 set of columns, 1 with A, 2 with B, C, that sort of thing, right? And another type of questions that are asked in physiology are calculations based. So you can get the calculation of few clearances. So what are the important topics in physiology? Mainly all sort of graphs from each and every system. Don't try to focus on one-liners at this point. Graphs of all physiological systems are important, and in general, nerve muscle physiology, renal physiology, nerve muscle physiology, renal physiology, and respiratory physiology are very important in physiology subject. So when you're doing respiratory physiology, predominantly spirometry type of questions will come, and try to integrate them with your medicine knowledge. So whatever you've read in medicine and respiration, especially spirometry graphs, try to correlate them with physiology and read and revise similarly, right? In biochemistry, now biochemistry I would say is a very, very important subject as far as your INI-CET is concerned. Around 17 to 18 questions I can guarantee you will come from biochemistry, and if you've read biochemistry, you can get around 15 of those questions correct. So if you have time, invest time in biochemistry, I must say. And as far as the important topics are concerned, see, all metabolical cycles are important in biochemistry. I know there are a lot of metab cycles in biochem, but all of them are important. Genetics and microbiology, now this is INI specific. This is INI specific, and you can see that almost in all previous INI, there is one question that is either coming from microRNA or microarray, that sort of things. So when you're reading genetics and microbiology, try to correlate with paths. So there is a chapter in pathology neoplasia where they've talked about genetics. Try to read along with biochemistry that chapter. Now, vitamins, very important again as far as INI is concerned, and vitamins have been asked recently in NEET also, so it makes it a more important topic. Now, immunology is an INI favorite topic, especially immunodeficiencies. INI is very fond of asking those questions, and try to correlate and integrate with pathology as well. At this point, you don't need to read immunology separately from pathology. Now, all the storage disorders, lysosomal storage, glycogen storage, there are some paroxysmal disorders, mitochondrial disorders, and those tables of apolipoproteins. All these 5 tables are important, very well given in first aid, I must say. So you can revise it from there if you have shortage of time. Now, biochemistry is one subject which is very well given in first aid, and a lot of students do read biochemistry from there. So if you are short on time, you don't find a resource to revise the entire biochemistry, I would highly suggest reading it from first aid. Now, coming on to the second prof subjects. So in second prof, I think according to me, pharma is the most important subject from second prof as far as INI. And in pharma, especially the formulas and general pharma bit, again, that is given very well in first aid. You'll be directly given all the values that you need to calculate from the formula, and you need to just put the formula and calculate the result. So if you're very well thorough with those formulas, and these are very well given in first aid, you will be able to solve the questions. Now, special topics, anti-cancer drugs, super important topics for INI. Anti-cancer, you cannot afford to miss it. Very well again given in first aid. And ANS is also very important in pharmacology. Now, when you're reading microbiology, try to cover antimicrobials along with microbiology. Okay, so regarding pharma, I would suggest to do it system wise while you're reading first and second prof subjects. For example, if you are on a nerve muscle physiology, try to read ANS along with it. So it saves your time and also helps you integrate concepts better, because INI-CET is a conceptual exam in my opinion. Now, in pathology, I think most of you already know, INI-CET focuses heavily on hematology, be it flow cytometry, be it WBCs, be it myeloid leukemia types. So, hematology you cannot afford to miss in pathology, and everything around hematology, be it types of red blood cells, be it type of schistocytes, and be it stains, flow cytometry, all these are very important in pathology. Now, apart from hematology, glomerulonephritis, you should definitely read. A lot of questions will come from renal pathology. And yes, hepatitis is a very important topic, and it integrates your microbiology, medicine, as well as pharma bit also. Antiviral drugs, direct acting antivirals, which are used in hepatitis C treatment. So when you're reading hepatitis from pathology, try to cover the pharma, micro and medicine part of it as well right here. Okay, now coming to microbiology. Again, microbiology is a super important topic for your INI. So first I told you biochemistry, and after biochemistry, I am telling you microbiology. If you want to invest time in something, micro is the subject that you should read. Now, what are the important topics in micro? At the outset, virology and fungus. Okay, so virology and mycology are very important topics, especially mycology. You'll definitely get few questions from mycology in INI. And try to read pharma bit also right here, antifungal drugs. Definitely one question. Now, biomedical waves, super important. 1 hour, maybe half an hour to 1 hour read, and one question highly likely. General micro, sterilization, disinfectants, all those sort of things. Very high yield, less time, more output. Okay, now coming on to the final year subjects. So I'm starting medicine, but to be frank, medicine not so important, because the type of questions that are asked in medicine in INI are very logical. If you attended your internships, you'll be able to answer 50% of those questions. But for the sake of completion, yes, emergency is definitely important, be it cardiac emergencies like MI, arrhythmias, stroke, SAH, or endocrine emergencies like DKI, HHK, mixed edema coma, and or thyroid storm. These are important for your INIs. Each and individual systems you don't need to read, just read the important emergencies of each. Now ACLS, PCLS also covers in emergencies, and it covers bits and pieces of MI, arrhythmia, stroke as well. And direct guidelines from ACLS and BLS are asked in INI. Now ECG, super important topic. Definitely sure shot one question will come from ECG, one question will come from electrolyte imbalance, and one question will come from ABG. So this is a sure shot thing. So if you want to invest time again, 2 to 3 hours per topic of these three, you will get 3 questions correct. Now all instruments, I've clubbed all the instruments together here. So from medicine, these will be cannulas, lines, tubes, or some procedures like bone marrow biopsy, or how to take an ABG, how to insert a central line, how to do an intubation, how to insert a nasogastric tube. So there will be few questions directly based on procedures. So you cannot really read it from anywhere. You have to attend postings, you have to do it to know them, but there will be definitely few questions directly asked from them. And apart from that, instruments of obs and gynae, orthopedics, ENT, ophtha, and surgery. These definitely two to three questions from these topics. Now from surgery, if you have to read one thing, in surgery, just read trauma. Okay, trauma definitely 2 to 3 questions will come, be it radiology related to trauma, be it management of shock, be it direct trauma related guidelines, what is the next best step, be it pneumothorax, be it hemothorax, be it pleural effusion. Definitely few questions from trauma will come in the exam. And we all know breast is an important topic in trauma. 1 or 2 questions from breast CA are likely to come again. Now, in previous INIs, you must have seen they are asking about biliary pathologies again and again, sometimes about biliary leak, sometimes what is the next best step, how will you manage it. So, biliary system again in surgery is important. Now, general surgery, super important, as I told you about the types of shock classification, wound management, scores of SSIs. These are again important topics from surgery. And if you still have time, you can invest it in thyroid investigation, evaluation of a solitary thyroid nodule, and peripheral artery disease and varicose vein, especially in varicose vein, CEAP score. All right. Now in pediatrics is not a super high yield topic, but important topics in pediatrics are the general pediatric bit. So for example, vaccination, you can combine it with PSM and study it in an integrated manner right now. Now developmental milestone, you'll definitely get one question out of it. You open any INI-CET paper, you will find that at least one question from developmental milestones they are asking again and again. Neonatology. Now, neonatology is a smaller unit in GHI, and in GHI, it is a complete neonatology. So, neonatology, definitely one question will come, and it's usually an easy question. If you have read neonatology, you'll be able to answer. And finally, growth and development. Again, easier topic to read, combine it with PSM and study it in an integrated manner. Now, obs and gynae, in my opinion, is also a very high yield topic, because the topics they are asking are limited. And here in obs and gynae, I think gynae is a little more important than obs for INI. And especially in gynae, cervical cancer, be it management, be it screening for cervical cancer, or pre-cancerous stages of cervical cancer, what we call as CIN, all of these are important. Now, one question from Mullerian anomalies you'll definitely get. And again, sexually transmitted infections, one question has been asked again and again in all the INIs. In OBS, especially peripartum monitoring, intrapartum fetal monitoring, partograph. Now, partograph has been recently asked in NEET PG as well. This is a very important topic as far as INIs are concerned. Again, and lastly, contraception. Contraception, again, is a super important topic. You'll get one question, and it takes a little time, around 2 to 3 hours, to complete the entire contraception, but it is again a very high yield topic. Now, PSM, INI does not focus so much on programs. It focuses predominantly on epidemiology and biostats. So that way it is a minor subject for INI. But if you're able to do epidemiology and biostats questions correct, you'll score high. And I think the best resource to do biostats in PSM is from first aid. Right? So don't skip biostats. It is a smaller unit. you can finish it quickly off from first aid as well. And lastly, we move on to minors. So in my opinion, among minors, the most important is forensic. Around 7 to 8 questions get asked from forensic itself. It takes a day to complete the entire forensic and you'll be able to get 7 to 8 questions correct. So if you have time, I would recommend you to read complete forensic right now because it is very high yield. Especially regarding some topics, toxicology is important. And try to read it in an integrated manner again from medicine and psyche point of view as well right here. And the IPC sections and PCP and DT, both of which are very volatile, especially the IPC sections. In ortho, definitely one question gets asked from bone tumors again and again. Nerve injuries are important. Try to integrate it with physiology and anatomy to know the types of nerve injury and what is their clinical presentation. And pediatric ortho. So AIMS is very focused and loves asking questions from DDH, CTEV, Perthes disease, SCFE. So pediatric ortho again an important topic. In derma, just focus on the images. So what I did during my preparation, I just went through Nina Khanna's important images from all the chapters, and especially leprosy, because leprosy, AIMS loves asking questions from leprosy, and try to integrate it along with PSM and pharma at this point. Now in psyche, if you have to invest at one topic, defense mechanism, I would say is the thing to go for, because you'll definitely get one question from defense mechanism. And the pharmacotherapy of psychiatry is super important. You can integrate it with pharmacology while you're reading psychiatry, and that will complete your entire psychiatry. Now, sleep disorders and topics like malingering versus factitious disorders, these are important. These are also important from psychiatry point of view, and they have been asked in the previous year's INIs. Now, ENT opthal, I would say just do the previous year questions because these are tough subjects in my opinion. And if you haven't read them, understanding them right now would be difficult. Just do the previous year questions, and if you have time, try to do the important topics which have been asked in the previous year questions. Anesthesias, from anesthesia, I think drugs are important, which will be covered when you read pharma. And apart from that, instruments in anesthesia that are used. So various types of LMAs or ET tubes, and the anesthesia machine itself, the various canisters with their color coding, all those sort of things are important from anesthesia point of view. So this was my whole overview of the important topics that are important for the upcoming INI, and I hope this video was helpful to you. Thank you.